Okay, I think it's time to start. Anyway, I'd like everyone here to welcome our friend Katrina Skinner. She's going to give a really interesting talk today. It's one that we had booked for the UC originally. We thought it was a really great topic, and we were excited enough to continue it. Here we are today. The title is, right, you can see up here on the slide, Close to Home, How One Pediatrician Manages and Leverages Practicing in Her Hometown. We know for a lot of our clients, this is the state of how they work. So we thought it would be an interesting talk. Now, I'm going to very briefly introduce Dr. Skinner and then my lovely assistant, Jan, because whenever you say assistant, you have to preface it with the adjective lovely. We'll take care of all the controls. I think Dr. Skinner, can you hear us and everything? Everything's good? Okay, she's good. So let me give you a brief background. Dr. Skinner was raised by wolves until the age of 12. And oh, shoot, that was Brandon Betancourt's. I'm sorry, I grabbed the one from yesterday by accident. I have to read Dr. Skinner's instead. She is a native of Fairhope, Alabama, a beautiful coastal town. I will agree, I've been there. She chose as the site to open her independent pediatric practice right after finishing residency at University of Florida, Sacred Heart. I've also been there. They have a giant PCC water tower. It's kind of cool because I forgot to take a picture. Anyway, she loves watching her hometown families grow and enjoys the challenges of a growing practice. Starting with 2 employees and 12 patients on her first day in 2009, her office now employs another full-time pediatrician, 2 mid-level providers, a practice administrator, and 15 support staff who help care for over 500 patients. As Vice President-elect of the Alabama chapter of the AAP, Dr. Skinner advocates for children and pediatricians at a local, state, and national level. She enjoys her role as chapter liaison for Reach Out and Read and the Chapter Practice Management Association. Last but not least, a little personal background. She loves entertaining and spending time in her kitchen. Most idle time is occupied with knitting needles in her hands. Do you say, is that bar? You pronounce that bar? Yeah, okay, thank you. Bar classes keep her mind clear and her body strong. She is steadily marking spots off her to travel to list with her husband and favorite person, Matthew. Though that's going to be tough this year. Her 21-year-old stepson, Christopher, is working hard to learn the other family business, which is scale model building, which is one of the coolest things I've ever seen. You will have to ask her about it. You can ask about her in the chat. So, Dr. Skinner, we're going to turn it over to you.
All right. Thank you. I appreciate that. And the one thing that Chip didn't mention in my introduction there is that I actually come from the dark side. So I'm very flattered to be asked to be here today as part of your users conference. And I promise I will not say those 2 letters at all during my talk today. So the first thing I want to know is, you can put it in the comment box or just talk to yourself if you want, but how many of you actually practice in your hometown? And if you don't practice in your hometown, do you want to, or would you consider it? Or do you just say, absolutely no way? I think maybe, it's a question that you could feel a little bit passionate about the answer to. So take a minute to think about that or make a comment if you want to. So I think before we get into this, it's important for me to lay a little bit of groundwork about why I even considered practicing in my hometown in the first place. And Chip did allude a little bit to this in the bio about the place where I live, but I want to tell you a little bit more about it first. And I do live in Fairhope, Alabama. That is where I spent my entire childhood. My family, actually, my grandparents moved here in the 50s. And so my mom grew up here, and my sister and I both grew up here. But Fairhope is a beautiful little town right on Alabama's Gulf Coast. We're about 40 minutes away from the white sugar sand beaches of the Gulf of Mexico. Our little city sits on the eastern shore of Mobile Bay, which is a brackish body of water. Our city is unique in that it was founded in the late 1800s as a single tax corporation. And if you don't know anything about that, I'll let you Google it. It is pretty interesting. Our city is beautiful. We have a thriving downtown, and our city spends over $200,000 a year just on flowers alone. And our city workers are like little elves at night, and they come in and they change out the flowers at least once a month when nobody's looking. And we even have flowers on the top of our trash cans in our downtown. So it's really a beautiful place. It's also a unique place because of our ecology. I mentioned that it's Mobile Bay is a brackish body of water. We have a very unique phenomenon that happens here, something called a jubilee, and it only happens in one of 2 places in the world. The other place happens to be in Japan. But a jubilee is a phenomenon that happens when certain conditions are met. It can't be predicted, but you can have an idea when it's going to happen because of certain conditions with the tide, the temperature, the wind, the phase of the moon, the time of the year. And when it happens, something happens with the water in a brackish body of water where the salinity and the oxygenation creates a wedge in the water. And it basically forces all of the sea life up onto the shore because they're trying to stay in the water that's their natural habitat. And basically they're suffocating. And that sounds terrible for the sea life, but if you like to eat seafood, it's good for you because it makes catching them really easy. You just go out on the shore and you scoop up whatever you want. And so this has gone on for as long as people can remember. And you can see in the picture there in the lower right, this is a very old picture. Back then, people would sound alarms and ring bells and, yell out Jubilee. And so everyone would rush down to the shore and collect their bounty of seafood. And of course, nowadays, people just send out a text message. But it's something that people absolutely love about our area. It fascinates visitors. There's pictures of it everywhere when you go into local restaurants. And that's one of the things that makes our town unique. One of the other things that makes it great for being a pediatrician here is that, our area has been named one of the top retirement communities, but it's also very attractive to families. And so there's lots of kids. And I'll say that we don't have 500 patients. We have over 5,000 patients. So we have a very busy practice that helps keep us going. So when I first started in practice, I kind of thought being a pediatrician in your hometown was going to be a little bit like this place. And I'm guessing probably most of you recognize this. It's the set from Cheers, and you all remember the theme song, and that line gets stuck in your head where everybody knows your name. And when I first started my practice, I was enchanted with that idea. I loved the idea of, going to the grocery store and sweet little kids would cling to my ankles. And I would give out advice to moms and they would just hang on my every word of advice and do everything that I said. And there would just be this sense of community and it was all rosy. And, that is the case to some extent. But there's also this evil twin sister side of it. And I'm going to talk a little bit more about that as we go on. And I'll tell you some stories that maybe will make you laugh, maybe make you cringe a little bit. So the other thing that I think I need to tell you a little bit about for background as to why I wanted to practice in my hometown is how entrepreneurship runs in my family. And so Chip mentioned a little bit about the family business, but I want to give you a little bit more groundwork about that too. And so this, when I wanted to come back to my hometown to practice, I could have easily just joined the existing practice in town. It's where I had been a patient as a kid, but it never really occurred to me to be an employee of someone else. And there's a reason. So you may wonder why I'm showing you these pictures. The photo on the left is my paternal grandfather, and he is a super funny guy. He's also a super smart guy. He's the kind of guy that if you gave him a present at Christmas and, say it was a blue and white striped shirt wrapped up in a box, he would shake the box and he would tell you, oh, this is a blue and white striped shirt. And that frustrated my dad to no end. My dad was the baby of his family. And so at the time, my grandfather and my father both worked as shrimpers. And so my dad decided one Christmas to build my grandfather this shrimp boat model for Christmas to give him a gift that he couldn't guess. And it worked. My grandfather was tickled. My dad was satisfied. And it was a good Christmas. Well, if you know anything about the shrimping industry, it's very volatile. It's very seasonal. And one winter when my parents were newlywed before I was born, times were a little bit tough and it was the off season. My dad didn't have much work. And so he put on his entrepreneur thinking cap and he started brainstorming things that he could do to make money. And so he takes this model that he had built for my grandfather for Christmas and he loads it up in his van and he drives down to the boat docks. And he finds some boat captain who's, they're working on his boat. And he says, hey, come here, let me show you something. And so the boat captain, looks at my dad and he's a little bit put off, he's trying to get his work done, but he's like, okay, fine, whatever. And so he goes with my dad and my dad opens the back of the van and he shows the man what's in there. And the captain sees the model and he's impressed. And he looks at my dad and he says, build me one. And so that first winter, my dad built 2 or 3 of these models sitting at the dining room table. And that's how he made ends meet for my parents that first winter. And so as a kid, I loved hearing this story. And growing up, it definitely, kind of became part of the fabric of who I was. And then I watched that business grow. It went from something that was a hobby into something that became my dad's career. And what was his career, which was shrimping, became his hobby. And my dad went from building models on the dining room table to having to move his business into a shed in the driveway. And then eventually we had to move from our house in town out to a bigger piece of property in the country so my dad could build a workshop and then an even bigger workshop because he had to have employees and equipment. And eventually he grew the business to the point where he had clients in companies and governments all around the world. And the best part is when he decided to retire, my husband and I had the opportunity to buy the business. And so now I am a full-time pediatrician, but I also get to be a silent partner in this model making business that has been such an important part of my life. And so you can see in the picture there on the right, an example of what the company does today. But the reason this story is important to me is because growing up, I always had that example of what an entrepreneur was like. And so, seeing my dad being willing to pivot, market himself, change as the market changed, identify what his customers needed, and being flexible, that just inspired me. And knowing that I never wanted to work for someone else, that the only person I ever wanted to work for was myself. And so that's why whenever, I went to graduate residency, I knew that the only option for me was to open my own practice. But that being said, when you practice in your hometown, things can get really messy and it becomes important to establish boundaries. And you have to do that early on. So I'm going to give you some personal examples of how I have found that to be true. So I think Jan gave this talk a really good title, but as I was starting to work on it, I decided we could have an alternate title as well. And so I'm also naming this talk, Hometown Medicine, How to Establish Boundaries from Day One. So with a quick show of hands, are there any Rush fans in the audience today?
You mean besides me?
Besides you, well, maybe. So I don't know, how many of you realize that Rush actually knew what it was like to be a pediatrician in your hometown? I didn't realize it until I was preparing for this talk and the song was on my Spotify as I was working. And I was listening to the lyrics and I was like, oh my goodness, these guys know exactly what it's like to practice medicine in your hometown, because if you see these last two lines, one must put up barriers to keep oneself intact. And that just clicked with me. I was like, that's it. That's exactly what it's like to practice medicine in your hometown. So I'm going to let you get that song stuck in your head and we'll keep going. So whether you're currently practicing in your hometown, you want to eventually practice in your hometown, or you're just completely happy where you are, I think it's important to talk about how and why leveraging your connections to advocate for your patients and community can strengthen your practice. So I'm going to suggest the idea that even if it's not your hometown, that you make it your hometown. And so I'm going to suggest first that you focus on building relationships. And I think this is something that we do inherently as pediatricians, but I did want to talk about it just for a second because I think that it's important. And I think the first way that we can build relationships both in and out of the office is by being present when you interact with someone. And so for me in the exam room, that comes, to me listening to cues that patients and parents give me about things that are important to them. So I also try to pick up on connections between patients in my office. Practicing in a small community where I grew up, I become aware of a lot of family relationships among the patients in my office. So when I know that two moms who are sisters both bring their kids to me, I like to make notes about that in a chart. When I was younger, I could just remember it naturally, but now I find that I'm not able to do that quite as well. So I make a lot of notes like that, either in the history or in the problem list. I also like to make notes about things with my patients. If they tell me about their goldfish named Bob or a sports championship that they won or a trip that they went on, I like to make notes about those things. And I know that you guys do that too. I also do that with people that I meet in the community. So, if I meet someone out in the community that, could be maybe a colleague or maybe someone who works in a different field, I make notes in my cell phone and their contact information so that the next time I interact with them, I'll be able to make them feel like I'm a little bit more invested in knowing about them. And I think even if you're not a native of that community, doing those things makes it seem like you're a little bit more invested and, kind of putting down your roots. So I think it's also important when you're building relationships to communicate clearly. And we know this as a pediatrician. We know that we need to use layman's terms with parents, and we know we need to make time to answer questions. I think it's also important that we share decision making to build trust. And when we do those things, when we are present, when we interact, when we communicate clearly, and when we share decision making, that helps us to earn parents' trust, and then they become our best advocates when we're building our practice and trying to establish a patient base. When it comes to leveraging your network, I look at this as how we're going to get out of our comfort zone and outside the four walls of our office. So one of the ways that you may leverage your network is by volunteering for a community board, or maybe you run for a local office. And I think when you do something like that, that's another way that you can tell your community that you value the community and you value your role in the community. I think it's also important to enlist the people around you to participate in those things with you. So your family, your friends, your patient's parents. Whenever you enlist them to participate as well, it adds, it shows that you also value those activities. Another thing that I think is part of leveraging your network is investing in your marketing. And so, I already mentioned how your parents are going to be your biggest form of marketing, which is, it doesn't cost money. You have to invest work to build the parents' trust, but it doesn't cost anything financially. But if you were on the PMI webinar last week, you heard Ari Brown talk about the different types of marketing that you could take advantage of as a pediatrician. And so take advantage of the message that you can control in order to say the things that you want your audience to hear and know about you. So I think if you will do these things, if you will build relationships, if you will leverage your network, then your practice will grow naturally as a result of those things. So I'm taking one for the team here, and I'm sharing this picture with you because I think another important thing that we should talk about is identifying prejudices that exist from your childhood that can affect the way that you practice medicine now. So a quick question, I want everyone to reflect on what you were like in high school. So think back, what kind of kid were you? How would people have labeled you in high school? And so this is a picture of me from 20 plus years ago. And clearly I was different back then. I had really long hair. I had what I considered to be a tan. I drank soda, and I think maybe I used disposable cameras. I think that's what that is in that little package by my feet. But some things I would say haven't changed. I still love blue jeans and sunglasses and lip gloss. And one of the things, more important things that hasn't changed is that I still have the motto of wanting to make an effort to be nice to everyone. And looking back now, I am so grateful that I practiced that as a kid, because I think it would be really awkward now to take care of people's kids if I had been mean or unfriendly when I was in high school. But what if someone from your childhood has a misperception of you? Or, for example, they think you're going to be the new doc in town, maybe who's going to save them from all those other mean pediatricians who are trying to poison their child with vaccines, right? And they come in and think that you're just going to be the end all be all. Or maybe when they assume more familiarity than really exists and they call your receptionist and they want to make an appointment with Katrina. Or, even better, they just want to speak directly to Katrina right now on the telephone. And so in the beginning, that would throw my receptionist off guard, and she didn't know how to handle it. And so we had to learn how to put up boundaries and how to handle those situations. But the prejudice can manifest in other ways too. How can our preconceived notions about people that we know from our past affect how we treat them as patients now. So I recently had an incident with a mom in the office, and she's someone I've known since grade school. We're going to call her Patty for our purposes today. But we had just implemented pandemic-related parking lot check-in. And so Patty came in with one of her kids, and she checked in with a nurse at the front door. But the nurse was already in the process of checking someone else in. But she had sent that mom back to her car to grab her insurance card. And for whatever reason, Patty didn't understand that. And when she was asked by the nurse to go wait in her car briefly, she bristled and she got offended because she thought she had been slighted. And what Patty didn't tell the nurse at that time was that the AC in her car was broken and she was worried about running out of gas. But what I remembered about Patty was that she had bullied me in high school into giving her a ride home after school one day. And I was one of those kids who was a serious rule follower. And my parents had told me, under no circumstances do you ever give anyone a ride home. And so I felt horrible when I caved and gave Patty a ride home from school one day. But, you know, who knows? Clearly, Patty liked me for doing her a favor, or maybe she just doesn't even remember it at all because 10 years later, she's still trusting me to take care of her kids. And so I had to put aside those emotions that she prompted in me as a 17-year-old who was really afraid of violating her parents' orders, and shift that to my 40-year-old pediatrician emotions of recognizing the ACEs and toxic stress that Patty and her kids were facing. And even beyond that, I had to create a plan in my office so that we knew how to appropriately react the next time a family with a similar situation came into the office. So that's just one example of how someone from my pre-physician life now exists in my physician life. So tell me, has there ever been a time when you've had to deal with something like this? And also tell me, where do the patients in your office come from?
So just so you know, you in the past a couple minutes when you were asking for people who had similar circumstances, you had, and for example, are you a Rush fan, or do you work in your town, or do you work where you grew up? You had a couple yeses from people you know.
Oh, good.
So we'll come back around to that in a little bit.
I like it.
We are wondering, however, if you had to Photoshop that Pepsi can. And we wonder if, in fact,
I didn't even like Pepsi. I was a Coke person back then.
we wondered if it might be a Coors Light in real life.
No, sorry.
Okay. All right.
Sorry.
Okay.
All right. So here's another fun picture for you. And I'll save you the eye strain. I am not in there. I don't remember where I was that day, but I missed the senior class picture. But I did have fun studying it as I was getting ready to scan it in. And I looked at each face individually and I started counting, and I realized that about 50 of my 227 classmates have brought their children into my office, which is pretty impressive, I think. And then if I think about, classmates from a year or two ahead of me or behind me, that number increases dramatically. And then I started thinking, well, where else do I get patients from? And, and then I think, well, it's my neighborhood, it's church, it's the gym, it's, community organizations that I participate in. And then it's my family. So keeping up with all these connections can be very exhausting. And so I find the older I get, the more I rely on making notes for myself of how I know people, because I pretty much recognize everybody I see now, but I can never remember where I know them from. So I have to make notes to help myself keep it straight. So another example of that is this photograph. This is a picture from my groundbreaking ceremony when I built my office. And these girls are 3 of my 5 closest friends from school. And one of them is even a girl I've been friends with. Basically, our moms met at our 2-month checkup at the pediatrician's office, and we've been friends ever since. But I take care of the kids of all of my friends. And I think that, that's not a dynamic that's unique to me or even to someone who works in their hometown. We probably have all been in a situation where we have taken care of the friends or the children of friends. But it can be really difficult to establish the boundaries in a relationship when, there are times when you need to be the pediatrician and then there are times when you need to be the friend. And this phenomenon doesn't just exist for pediatricians or physicians. I was talking to a patient's dad in the office not long ago, and he had just been elected as a county judge. And I was asking him if he was enjoying it, if it was what he expected. And he told me that he was kind of surprised that he had basically had to either sever or put on hold all of his friendships because he could no longer, mingle with any of the lawyers in town because he couldn't be seen as showing partiality to any of them. And so he was a little bit discouraged by that, and a little bit saddened. And I thought, that's similar sometimes to how, as physicians, we have to create boundaries with relationships. So tell me in the chat box or however, just think about it to yourself. Have you ever experienced a situation like that where you had to redefine a relationship because of your career as a physician?
So just so you know, or just to add to that, I haven't to do that. I have not had to do that because of my career, but I used to play poker with a small group of guys, and one of the guys became a local traffic judge in another part of the state, was no longer allowed to be in our poker game. And another guy's wife became a judge, so he was no longer allowed to play poker.
Yeah.
So, which caught the rest of us off guard, especially because we enjoyed collecting their money. That was the worst part. But yeah, so your examples are really good.
Thanks. All right, let's see here. So another thing that I think is important when you practice in your hometown is learning how to develop a thick skin. And we're all familiar, we've all been a victim of the scathing anonymous online review. I've had people criticize me for the shoes that I wear, the fact that I don't have biological children, that I talk too much, I don't talk enough. We all know about those anonymous reviews. But when the negative review comes from someone that it's a little bit harder to let it just roll off your back. So at the beginning of the pandemic, a pediatrician in a neighboring small town was one of the first patients in her community to contract coronavirus. And she's absolutely fine, but because her town is so small and she's so well known there, the news of her infection spread like wildfire. And as news does, especially with social media, things were blown out of proportion. And it got to the point where she had to go to local media outlets and publish an editorial basically exposing everything about her health and her illness, outlining the steps that she had taken to diagnose herself, to protect her family, her staff, her patients, and then highlighting her entire recovery and quarantine phase, just to try to mitigate some of the negative effects of all of that, basically all the rumors that had been started about her. And so, people sometimes treat physicians like they don't have feelings like other people, but, we do, that. And, living in a small town, I think, can amplify that sometimes. But, when people assume this familiarity with us, it can lead to occasions of privacy invasion and emotional assault. And that can make it difficult. So, developing thick skin is definitely something you have to work on. Oh, and just because I didn't want to leave you hanging, we did eventually build the office, and this is what it looks like. So in another presentation that I give, I talk about going from being the chief everything officer, where you've got all the plates in the air, you're always running behind, you never seem to accomplish anything, to being a chief empowered officer, where you are getting your tasks done, everything is running according to your schedule. And I'm just wondering how many of you can relate with being the chief everything officer, where you feel like everything falls to you at home, at the office, the volunteer work, the kids, and you never feel like you're catching up. But one of the things that differentiates the chief empowered officer from the chief everything officer is that the chief empowered officer has figured out how to implement boundaries in her life. I've talked to a lot of colleagues who practice in small towns, and particularly in their hometown, and many of them have experienced burnout. And what I have found from talking to them is that it's impossible to be on call 24/7, attending deliveries, making rounds in the nursery, admitting kids to the floor, seeing patients in clinic, And then also to basically be the private physician to all of your friends and family 24/7 without experiencing burnout. And I think the problem is that it's, very difficult to establish boundaries in that situation. To be an effective hometown physician, you have to establish boundaries to protect yourself. And so, what are boundaries? Merriam-Webster defines a boundary as something that indicates or fixes a limit or an extent. To me, I just sum it up as a boundary being when I respect myself and I insist that other people respect me as well. Well,
Except for your Mac.
I know, it's not obeying me. So how do you implement boundaries in practice? And so I came up with a few tips that I thought were helpful. Basically, I've learned some of these things the hard way. So the first thing that I identify is to identify your boundaries early. And of course, I didn't know that in the beginning. I learned this lesson the hard way. And I could tell you so many stories about how people overstepped my boundaries in the beginning because I didn't know what they needed to be or how to define them clearly. But if you consider practicing in your hometown, or if you're considering establishing a physician relationship with someone with whom you already have a personal relationship, you have to identify and communicate your boundaries very early on. It's also important to understand that you're not going to please everyone. We know this. We see this in our practices. But there are a lot of people who will have preconceived notions about you. Just like I mentioned earlier, like maybe somebody expects you to follow their alternate vaccine schedule when you don't, you have no intention of doing that. But some people will not be happy regardless. And it's not our job to please those people. We know it's impossible. So your boundaries are there to protect you and your sanity. It's also a good idea to set expectations without an apology. You don't have to be sorry for your boundaries. And like I said, your boundaries are there for your happiness and the happiness of your family. I think it's important that you set your boundaries for the relationship in your office, in public and social settings, and then also in social media. You should let parents know that you're not comfortable discussing their child's healthcare in front of other people in a public setting. I had a parent one time come up to me at our city's annual Christmas parade, and I was with my husband, and she came up to me and started asking me questions or telling me things about her child's private area problems. And my husband's standing right there, and it was very uncomfortable. And so I had to figure out a way to, kind of let her know that it wasn't appropriate, but at the same time, kind of give her clues as to what the appropriate way was to handle that. And so, you will be faced with those situations, and you have to kind of have a plan ahead of time for how you're going to respond to them. If you're not comfortable with just establishing the boundary, you can always blame it on HIPAA or blame it on your malpractice carrier. There are ways that you can kind of back yourself up if you're not comfortable just asserting yourself. The other thing that I found to be very helpful with establishing boundaries was being able to delegate. And so, when parents would contact me through an inappropriate channel, say, if a parent would send me a message on Facebook about their child, I would not respond, but I would have my nurse call them. So I would respond through the appropriate channel, even when they connected with me on the inappropriate channel. If a parent has my cell phone number and they send me a text message, I will have my nurse call them back. If they send me an email, again, I have the nurse respond. I pay my nurse for a reason. And so I let her do that work because that is a task that she is trained to do. If a parent stops me in the grocery store, tries to ask me a question, I just let them know, that I need to be able to have your child's chart in front of me. So why don't you call the office tomorrow? Let's set up an appointment. Or if you feel like it's urgent, go ahead and call the after hours number. Along the same lines of delegating, you can also use your out of office reply or use your voicemail greeting to let parents know that, they're not contacting you in an appropriate manner, but give them the alternative way to connect with you. So my voicemail says, if you're calling about a patient matter, your message will not be returned, but instead you should call the office. And so I give them that option. I would personally tell you Do not give out your cell phone, guard it with your life. I know some people disagree with me on that, but personally, for my mental sanity, I like keeping my cell phone number to myself. I think also along the lines of delegation is you don't want to teach parents that you're the first stop. So whenever I start seeing parents in the office from the very beginning, I teach them the appropriate way to connect with the office. So they would, I don't give them the idea that it's okay to ever initiate contact in an inappropriate manner. So, I tell them our phone at the office is answered 24/7. I have a nurse on call around the clock to answer your questions. So I've phrased that in a positive way so they understand that someone is always available to them. It just doesn't necessarily have to be me. So the other thing that I think is very important is to standardize your boundaries. And this is a tough one because it's easy to say, when you're dealing with no-shows or patients who refuse checkups or maybe bad data or bad behavior, it's easy to say, we have this policy, we're going to discharge or we're going to send to collections or whatever we're going to do when that's someone you only have a professional relationship with. But what if, that happens when the patient is also your high school classmate's kid, or maybe it's your neighbor's kid? It gets a little bit harder to implement those standards. So knowing up front that this is how we're going to handle it, and incorporating your team to help you with that, having an office manager or a practice manager that can help you implement that can be useful too. But what I would tell you is if you can't see yourself being able to implement your boundaries with a patient, if you can't imagine yourself having to fire someone if they were to violate your policies, then don't have them as a patient. Likewise, if you can't imagine yourself being fired by a patient, then probably best not to initiate that relationship in the beginning either. One of my best friends is a local OBGYN. And when she was pregnant with her only child, we got together for dinner and we were chatting about who her pediatrician should be. And of course, we both agreed that I was the best pediatrician. She sends me all of her patients. But we started talking about it and we realized that we really didn't want to jeopardize the intimacy of our friendship by adding the professional relationship of me being her pediatrician. And so we decided that she would use a different pediatrician. And now that her son is going into kindergarten, we're still completely satisfied with that relationship, and neither one of us regrets it. So just think long and hard about those relationships. And I think, if it's your friend or your family member, they'll appreciate when you have that conversation with them and let them know, if you're honest and you let them know, that you don't want to sacrifice one relationship for the other, they should understand. So another key part of practicing in your hometown is the possibility of treating or working with family. And so how many of you here have ever treated a family member? Or maybe you've ever employed a relative? So of course, boundaries are going to be even more important here. And I'm not here to tell you I have all the answers about this either, but I have learned a few life lessons in this department as well. So in the picture on the left, you can see my sister. She's one of my nurse practitioners. And she has worked for me since I opened in some capacity. And over the years, we've found our groove, and we love being together in the office. We think it's so much fun when our patients and their parents confuse us with one another in the office and out around town. I especially loved it a few months ago when one of our precious little 9-year-old high-functioning autistic patients told my sister that she looked just like me, and my sister is 7 years younger, told her that she looked just like me, except she has more wrinkles. And, so it's fun. But I think the thing that you have to remember is that it hasn't always been easy. And sometimes family drama can easily start to creep into the office. And so you have to recognize that and be willing to check it at the door. There are other times when maybe you might consider hiring a family member. Just like my sister works for me, but you have to have boundaries. Who knows, maybe you might consider hiring your mother, and you might learn the hard way that it's difficult to be, or maybe impossible to be her boss and her mother. you may realize that you can only do one or the other, and that could be a really hard boundary to learn. So I'm not going to tell anyone here that you shouldn't hire a family member, because, you know, that has been successful for me. But you should think long and hard about it, because you have to think about, can you imagine yourself giving that family member an employee evaluation? Can you imagine yourself giving them a reprimand? What if you had to fire them? What if you caught them embezzling? Or what if they were taking advantage of you in some other way? How would that affect your relationship with them? How would that affect the dynamic in your entire family? So you really need to think about those things before you hire a family member. You may also be asked to treat family members. And, you know, in some smaller communities, that may even, you know, be a necessity. So in the picture on the right here, these are two of my little nieces, and this is a fun little ad that we did. But I do take care of my nieces, and I take care of some second, third, and fourth cousins. And, you know, the question becomes, can you compartmentalize? And, you know, can you be the pediatrician, and then can you also be the aunt or the uncle or the cousin? And so for me, I have found that, you know, I'm comfortable doing some simple things for them. You know, I can do a checkup when they're younger. I can check their ears. But if it's something more complicated, or you know, if my sister is a little bit more worried about something that's going on, I typically defer that to my associate to provide the care for that, just so that I you know, we can maintain more, you know, I can be aunt first and foremost. So the last thing I think that's complicated when you're dealing with family as a physician, well, there's two things actually. So the other thing that makes it tricky is, if you are treating family, then you have to deal with things like your grandmother calling you, and she'll say something like, well, what was wrong with little Johnny today? You know, or why isn't little Johnny growing? Don't you think he's too small? Or, you know, why didn't you give him an antibiotic today? And, you know, I mean, you can't talk to your grandmother about that because, well, HIPAA, but she's your grandmother. You have to be polite. What are you going to say to her? So you have to know how you're going to handle that. But the last thing I'll say about dealing with family as a physician is not specific to practicing in your hometown, but it's a very important example of how you should establish boundaries. And so it might be something like this. Maybe a relative calls you and says, you know, so-and-so is visiting me from out of town. They forgot their medicine at home. Can you just call some more in for them? Or, you know, so-and-so needs an appointment with such and such doctor. Can't you just use your doctor card and call and get them an appointment sooner? And, you know, while you could do these things, are you comfortable doing it? And so, you know, having, you know, kind of defining before it ever happens how you would respond, and then responding consistently every time. So practicing in your hometown isn't all just pain points. I know I've talked about some things that maybe are a little bit uncomfortable, but I think practicing in your hometown provides a great opportunity for you to be an advocate for your patients and your community. And a lot of times as a hometown doctor, you often have knowledge of challenges that your patients and their families face, even if they don't share it openly with you in the office. So like, for instance, remember Patty earlier from the parking lot story. Because I had given her a ride in high school, I knew the kind of environment that she grew up in. So I was more aware of the potential ACEs that her kids may suffer now. I think also as pediatricians, we have to be advocates because our patients can't speak for themselves. And so something that I have always taken to heart is this saying that my grandmother used to say to me all the time. And she used to say it to me because she was trying to get me to eat. So, you know, you want another piece of cinnamon toast? Well, you have not because you ask not. Or you want a chocolate milkshake? Well, you have not because you ask not. But as I got older, I kind of turned the meaning of that statement to be more of a motivation to me to go after things that I wanted. Because basically, you know, it's not going to be handed to you. If you want something, you have to go after it. And I've had the privilege through my position with the Alabama chapter of the AAP to go before the Medicaid commissioner of our state, as well as the Blue Cross executives, to make some requests for coverage of things that weren't previously covered prior to the pandemic. And we've been very successful in getting those things covered. But if we hadn't asked for those things, it's very unlikely that they would have given them to us. And I think that's important because we have to be willing to speak up and ask for those things. A lot of times, I think pediatricians especially, we're nice and we kind of go with the flow, but we need to use our voice and start asking for these things that are important, especially because our patients can't ask for themselves. So another thing that we've asked for is media representation. And I know there's been some talk about this on the PMI conference, but we've asked local media to do some coverage for us. And through that, we've asked our community for PPE donations, and our community has come through for us. Another way that we've incorporated things into our community, and we've done some advocacy, is just giving back. And so we've used social media to do some Facebook Live story times for our patients. We have given to our moms with flowers for Mother's Day, and then we've given back to our staff by doing yard signs to show our appreciation and to help just make them feel a little bit happier. But I would say that, even if it's not your hometown, none of these things are specific to being a native. You can do these things to help you be more rooted in the place where you practice. So what they say in real estate: location, location, location. But I will tell you, if you remember nothing else, please remember boundaries, boundaries, boundaries. That is the most important thing if you're going to practice medicine in your hometown. So I've put a little list of my takeaways here. I'm not going to read all of them, but they're available if you want this as a summary. But I will tell you that no matter what your birth certificate says, you can make the place that you practice your hometown. And just think of it as your hometown advantage, whether it really is your hometown or it's the one that you're creating. So thank you very much for having me here today. I have had a great time, and I'm happy to answer any questions.
All right, Jan and I are going to be watching the live chat for questions to share, but I have a couple for you already.
Okay.
All right, the first one is, you gave some really good suggestions about how to manage expectations, but you went quickly by the little bit about having to have thick skin.
Yes.
And I'm wondering if you have any suggestions or experiences that you can share about the things you've needed to do to make sure that your skin is thick in the right places, but you still remain sensitive to your families and your patients.
Yeah, that's a great question. So I would say part of it is just practice. It gets easier the longer you do it. And I think I've just tried to teach myself that the only person I can control is myself. I can't control what other people think. I can only control my own reactions. And then I try to focus on the positives. I know that 99% of my patients are happy and they love me. And like I said earlier, you can't make everyone happy. And I try not to get too hung up on that. If there are people who are just going to insist on being unhappy, despite us doing our best effort, I just have to let that go. And so I would say just practicing and reminding yourself of those things. And then, also having the boundaries and taking time for yourself. I think that's something that, a lot of physicians, especially women, we tend to put ourselves on the back burner. But if you will make time for yourself, that will help you to have a better outlook and a better perspective on that.
Okay, thank you. That's good. The other question I had, or the topic I wanted to get into a little bit more, is your comments about the decision you made with your friend to not be her pediatrician, and which I thought made a lot of sense. And I wonder if maybe part of what makes that conversation possible is the implication that if she works with this other pediatrician and something doesn't go quite right, she can still always call on you in a pinch, or if there's an emergency, or if there's a real problem. But the fact is, if she goes to another pediatrician, has enough of a bond, the well visit, that conversation is going to go just fine. That kid's going to be just fine. Not, whatever the number is, 95% of the child population turns out all right. And maybe just the addition of that language to say, hey, let's do this, because I thought you put it really well. Let's not sacrifice this relationship for the purpose of having a professional one. But you could say, but look, if it doesn't go well, I'm still here to help you navigate those waters as your friend.
Right.
And I wonder if that came up, or it was just sort of, if you two understood it naturally, if that's what the.
Yes. And I would say that we even had the discussion of, you could be a patient in my office, but not my patient personally. But the way we practice in our office, we just kind of share all the patients, so that
wouldn't happen.
Wouldn't have been. But, of course, and she knows that she could call me anytime, but her kid's healthy and she really hasn't needed that. And we have been very satisfied with how things have worked out. And one of the other things I meant to say earlier when talking about taking care of friends' kids, I'm very blessed, and that my nuclear group of friends are all very respectful, and we have a great working relationship.
I thought you were going to say didn't have kids.
No, they don't have kids. But we all do great. They come in the office. They respect me as their friend and their pediatrician. So I've never had an issue with any of my friends. It's the people who assume more familiarity than really exists, right, where I typically have an issue. But with my actual close friends, I've never had an issue.
And does it ever happen as a pediatrician? I mean, I'm asking you directly, but there are people watching. Does it ever happen to you as a pediatrician where you have a family as patients, as clients, but later on you become friends, like, when their kids are 3 or 4 or 5 years old, and so it's the professional relationship that comes first, and then it's the social relationship that comes after, and that's another style of navigation entirely.
Yeah, I know that does happen with some physicians. For me, it hasn't so much been the case. And I think that's more so because I'm at a different stage in life. My stepson is 21. And so
You're not seeing them at school anymore or whatever.
Right.
Yeah, my mom, I mentioned this in the chat. My mom was the local junior high nurse forever, which means she got to know everyone's business. Mm-hmm. It also meant that when we would walk around town and she saw some, oh, God forbid she saw kids smoking. All right. It could be in the middle of the summer. And if they saw my mom, that was the other thing, they would run from her.
Right.
But it's the same thing where that boundary doesn't exactly exist. And it never existed in my mom's head. And she would, if she saw a 12-year-old kid anywhere, anytime, she would go up like a school nurse to them. And I think that you have to have the right personality to be able to pull that off.
Right.
I would imagine right now, as a physician, being out in public and seeing your families behave poorly in the context of COVID has got to be very challenging.
Yes. I would say one funny thing, I had gotten to the point where I kind of hated going to the grocery store. And so that had become the job of my husband. But now that I can wear a mask and a hat, the grocery store.
You're in disguise. Yeah. That's right. And you need to wear a wig and a mask that gives you like a beard, and no one will know who this is. It's perfect. All right. Well, I think we technically are going to wait. Dr. Schaefer has a question. She asked patients on a date to see Sesame Street live. That's where her boundaries are, obviously, in a fun place. Yeah. Here's a question. We'll make it your last one unless someone comes up with a good one. Has the arrival of telemedicine affected any of this for you, or has it created new challenges, or has it made some things easier?
I don't think it's made any challenges other than just the technical challenges of telemedicine. There are patients who don't warm up to it. But, it's been fun. I think probably like everyone's experience, you get to see your patients in their element.
Right.
We've had we saw one dad sitting on the porch drinking a beer in the background. Kids like to show you their pets. But as far as, the hometown aspect, I don't think that has been any different. for us with telemedicine.
Do you do your telemedicine from your office, or do you do it from home?
We do both. So I typically do most of mine from the office, but some of my my associates and my extenders will do some visits from home.
So for you, the visual that your patients see is something they're used to. But if you were to do one from home, I think you would actually need to be conscious of where you're shooting that from, just like we all are. Like I come into the office because I don't need you all to see my my home. That would be horrifying for everyone. And so I think as a physician, that's a pretty important layer to keep in mind.
Yeah, I mean, a lot of my patients know where I live. They knock on my door to trick or treat.
Yeah. It just is.
Yeah.
All right. Well, thank you. This is a great talk. This truly is a great talk. And I just so you know, I cut a picture out of your rush slide and I sent it to all the rush guys here at work. And the first response was, "Oh, now I have that song in my head." So
good.
that's what you had asked for.
Mission accomplished.
Mission accomplished. All right. Well, thank you, Dr. Skinner. We appreciate it, even though you're from the dark side. But hopefully we will have Dr. Skinner on again. Thank you.
Thank you so much.